Good morning, everyone. Good morning, afternoon, evening, wherever you are. My name is Julie Perkins. I'm the OIC with GWOPA, the Global Water Operators Partnerships Alliance of UN Habitat. Welcome to this, our third in a series of webinars connecting utilities and experts around issues of COVID. This particular issue is around wastewater, and looking at how the presence of wastewater of COVID in wastewater is potentially a risk, but more likely an opportunity for utilities. We're very happy today to be working with GIZ for this particular webinar. We're always able to put these on with the help of a set of partners. Craig, I'm not sure if you're able to go to the slides. But we thank very much our regional platforms, particular the LAC platform that's always very helpful in identifying some good speakers, and as well as the African and Asian partners that are on the screen. Before we begin, let me do a quick introduction to the Zoom tool for those who are not familiar with it, so you know how to take advantage of it. We have translation, we have interpretation into English, French, and Spanish. At the bottom of your screen, there should be this globe that you can see. If you don't see it, just hover your mouse around and it should appear. And then you can choose the language of your choice. If you do not speak French or Spanish, please select English so that you will hear the translation from French and Spanish when it is spoken. We also have a question and answer box at the bottom of the screen that will pop up as people are speaking. Please feel free to enter in questions, and you can also like questions that have been asked if you would like someone to pay attention to that question. There's also a chat box into which you are welcome to put other comments and any kind of technical questions that you may have. And we will have some polling. We will interrupt the discussion at some point and have some polling to ask you some questions so that you can partake as well in the discussion a little bit more. We'll explain that as it comes up. I would now briefly like to introduce our partner in this webinar, GIZ, Mr. Dieter Rottenberger, who's the head of sector program for Sustainable Water Policy and Nexus, based in Bonn. If Dieter, you could say a few words, please.
Yes, thank you very much, Julie. Thank you very much for the introduction, and thank you very much also for the technical guidance, which is key, I think, to make such kind of webinars successful. In particular, considering the huge amount of attendees which we have this time again. So I'm very pleased to welcome all of you as a co-host on behalf of GIZ and the German Ministry for Economic Cooperation and Development, the BMZ. And I'm happy to see there are so many participants interested in this crucial topic of COVID-19 and wastewater management. We started this webinar series together with GWOPA, I think, 6 weeks ago, something like that, as a trial to test the waters, if there's any kind of interest in this kind of topics of how utilities are dealing with the challenge of COVID-19. And so I'm really stunned. I'm really, excited to see that we have now a full-fledged webinar series and participants always in the hundreds. So that's great.
À laquelle participent plus de... Non, il y a un problème. Il y a un problème. Allô, allô.
You have a translation problem?
Bueno, hay un problema de traducción.
Just a sec.
Okay.
Always pleasant.
You let me know when I can go on it, but actually I was always almost at the end. So I just wanted to wish everybody a fruitful and interesting webinar with a lot of lessons learned, a lot of interesting exchange. So thank you very much, Julie, for organizing this again. Thanks a lot.
Thanks to you and Hannah so much for all of your work in helping us organize this one. Can we carry on? It seems like the translation problem at least has disappeared from this side. I'll just carry on in that case. Everything good, merci, okay. So if we could go to the overview slide just to show what's on the program for today. We have an hour and a half in front of us. And I am very much hoping that you will forgive us our abysmal gender balance in today's program because of the excellent lineup of speakers that we do in fact have. We will first have a keynote from Kartik Chandran from Columbia University, who I've seen speak before, who's very excellent, and then be joined by Dr. Christoph Ort from the Swiss Federal Institute of Aquatic Sciences and Technology, who will give us some sort of framing pieces at the beginning. I'd like to apologize that Dr. Graham Alabaster, our colleague from UN Habitat, was going to give a little word this morning as well. He's unfortunately had a loss in the family and is unable to join us. Today's our thoughts go out to him. And then we will have a panel discussion with a number of utilities that we're very happy to have join us from Paris, from Kampala, from Malaysia, and from Buenos Aires in Argentina. And that panel will be moderated by Nitya Jacob from Susanna. So without any further ado, let me please introduce our first speaker, our keynote speaker, Kartik Chandran from Columbia University. Please go ahead.
Thank you, Julie and colleagues. It is my pleasure. Thanks for the opportunity to present some of our recent work here, very recent and emerging work. Perhaps I could share my screen to present the slides. Thank you. Okay, can you see my screen? Okay. All right, thank you. Okay, so today I'll be presenting some results which are just coming out every few days as we engage in sampling campaigns in many parts of the country and in the US and many parts outside the country as well to characterize viral diversity and the fate of viruses through treatment operations in sewage treatment plants and fecal sludge treatment plants. Now, I must say right at the very outset, yes, we are deep into a crisis and we are trying to dig our way out of it. And although it might be tempting to focus on the main protagonist at hand here, SARS-CoV-2, and fully appropriate for sure, what we decided to do was actually take a step back and use this crisis as an opportunity, not just to track, not just to characterize SARS-CoV-2, but then take a step back and try and look at other players in these systems as well, including other viruses, other organisms, bacteria, archaea, and other organisms as well. And although I focus on the results primarily on viruses, the data that we have includes many more organisms. So I must acknowledge the researchers on this project as well, which include researchers from Columbia University here in New York, which was I think which was and is one of the most badly hit areas of the world actually, but also partners outside the US. And for this specific work, I'd like to acknowledge the Center for Science and Environment in Delhi in India, who've been instrumental in our monitoring efforts in India. So I'll start with the work being done in India. We are broadly targeting both sewage treatment plants and fecal sludge treatment plants in India, and this is part of an overall activity which is supported by the Bill and Melinda Gates Foundation. This work obviously started quite some years ago, prior to our realization of SARS-CoV-2 for sure, and the objective of this work is to generate information targeting microbiomes in sewage treatment plants and fecal sludge treatment plants. So when I say microbiomes, essentially characterizing the diversity, the abundance, and activity of organisms across the different branches on the tree of life. And the data is quite extensive and allows for the framing. Of course, it gives us data, it gives us some answers, but it also allows us to frame the appropriate questions. The data is there forever, so we can go back and ask other questions as needed. And, you know, right when of the year, we decided to go back and look at our data, not with the magnifying glass of bacteria or archaea or some other organisms, but with the magnifying glass to zoom into viruses. And that's what I'm going to focus on first. And then I'll share with you some of the results from a bit closer to me. Okay, the sample collection is, these are just some renderings of sample collection, which is led by our colleagues at the Center for Science and Environment in Delhi, in India. And the samples are collected following fairly benchmarked and standardized protocols that we have developed as part of a global microbiome studies around the world. Essentially, samples are preserved and shipped to Columbia University for molecular analysis, almost immediately post sampling. For characterizing the microbiomes, we follow a few different approaches. We have our own capabilities for sequencing at the DNA, RNA, and protein levels. We also have our own servers, bioinformatics servers, and I'm just mentioning this just to highlight the importance of not just the techniques and technologies and tools, but also the prospect of capacity building, which we've also been able to do. So we quite often host researchers and professionals from our sector well, right here to to share certain approaches, to share techniques for characterization, interpretation, and so on. A lot of the work is done post-analytical work, and so researchers can log into our servers from around the world to interpret their data, to analyze their data, and develop answers, I guess. Okay, this is the kind of data that we get, and I'm going to show you essentially two types of data. One is from STP, so sewage treatment plants, and then fecal sludge treatment plants as well. We sequence both at the DNA level and at the RNA level, DNA level and RNA level, and we are able to then pull out organisms that we are interested in tracking or just broadly characterizing without targeting anything. So we get the overall landscape as well. So the point of this slide is there's a lot of information. It is very, very, very rich in the content. Okay, so let me jump right into the virus work that we've been doing in India in 6 sewage treatment plants, which we can look at here in the legend. So the first 6 here, even though the acronyms may not mean much, essentially there are 6 sewage treatment plants, 1, 2, 3, 4, 5, 6, and then the bottom 3 are fecal sludge treatment plants. And I'm just showing you the viral diversity as obtained through DNA sequencing and RNA sequencing. We all realize that there are different types of viruses, DNA viruses, RNA viruses, single strand, double strand, and so on. So with our analysis, we are basically able to capture everything. And so, the bottom line here is DNA and RNA viruses are present across the spectrum in sewage treatment plants, fecal sludge treatment plants with DNA and RNA. The way to interpret this profile is that the concentric circles here represent each of these systems. The height of the bars here corresponds to the relative abundance of the different viruses that we are finding. I don't expect any of us to zoom into any of this because it's not really legible, but essentially the bottom line is, if we look at the DNA viruses, there we see a bit, some more colors, essentially reflecting that the diversity of DNA viruses across the board in sewage treatment plants or fecal sludge treatment plants is higher than the diversity of RNA viruses, which are predominantly represented in this blue color. And there are some major players within the RNA viruses, which include, not unexpectedly, some plant viruses and some rotaviruses as well, which have a human link to this. And by the way, in these profiles, I'm just describing to you the diversity of DNA and RNA viruses in the influent sewage streams or in the influent fecal sludge streams. So we've not yet gone into the treatment process. So right off the bat, we're seeing distinctions in the DNA and RNA viruses. And at this level, it is not possible to look at coronaviruses. I'll get to that in just a moment. Okay, so then the next point is not just to characterize what is coming in, but to ask the question whether these barriers that we have designed and implemented in some parts of the world at least, which are primarily focused on improving water quality to see if they can do anything at all to specific viruses and viruses in general. So that's the second part of this talk. So viruses in sewage treatment plants, and then we'll go to fecal sludge treatment plants. And so again, a lot of information here, a lot of new information here. I've again tried to discriminate between DNA viruses shown in the blue bars and RNA viruses shown in the orange bars. And the nomenclature here is for, again, first we focus on STPs. So A is the influent, B is the treatment process, C is the effluent. So you'll see ABC, and for 6 treatment plants. And again, just taking a step back, and we'll have time, I think, for a Q&A. Basically, the bottom line is that DNA and RNA viruses behave divergently across STP operations. In fact, there is an overall increase in the relative proportion of DNA sequences through the treatment processes, which was a bit unexpected. And there is no real systematic trend in RNA sequences through the treatment process. Not a decrease, but no systematic trend in RNA viruses. So this is somewhat, this raises some questions, obviously. And now we can zoom into, for the same systems, within the RNA viruses, we can look at coronaviruses. Coronaviruses cause all sorts of afflictions in human subjects, including the common cold. And a part of the coronaviruses are SARS-CoV-2. Here we're just looking at coronaviruses, and we find that before the pandemic in India, this is all before the pandemic in India, the latest samples were around the latter half of 2019. So before the pandemic in India, we don't see too many sequences relating to coronaviruses and SARS-CoV-2 in the sewage treatment plant samples, not just in the influent ABC, but also through the treatment processes. Perhaps this is a good thing. Perhaps this is actually a good thing. Now I'd like to spend just a few moments on this very, very, very recent set of results from sewage treatment plants again, but not in India, but in the US. Again, this is from a region which you're not allowed to share exactly which specific region, but this is one of the worst parts of the country, worst hit parts of the country actually, up till a few weeks ago. And again, what we are doing here is we are tracking now. This is not sequencing. This is specific quantitative tracking of SARS-CoV-2 during the pandemic, not before or after, during the pandemic, as we are living this right now. And we are tracking a couple of different sewer sheds, sewage treatment plants. I'm presenting to you one highlight from a specific treatment plant. And essentially what I'm doing here is I'm tracking, again, the fate through the treatment plant. We have 2 biomarkers for tracking SARS-CoV-2, N1 and N2. This is all based on the CDC guidelines, the Centers for Disease Control guidelines here in Atlanta, Georgia. And so basically what we're doing is we're tracking across time based on these 2 biomarkers for SARS-CoV-2 specifically, but then through the plant as well. The bottom line, again, just to give you the highlights, there is little impact of disinfection, such as operations such as chlorination on the virus. And again, I present this because the knee-jerk reaction in the sector is let's add chlorine. Doesn't seem to be very, very impactful. The other big highlight is that SARS-CoV-2 is an enveloped virus, so it does associate with solids, which is what we can see here. And there seems to be some removal of SARS-CoV-2 through the plant operations, so which is a good thing. So if I just compare this to this all the way, so we are just tracking. So there seems to be some removal, and that's a good thing. Let's go to the fecal sludge treatment plants now. This is going back to India, shotgun sequencing, DNA and RNA viruses, again, behaved divergently. There was again an overall increase in the relative proportion of DNA sequences through the fecal sludge treatment plants as well, as we had seen in the sewage treatment plants. And there was a relative decrease in a relative decrease in the relative proportion of RNA sequences. So some distinguishing features in STPs versus FSTPs. Now and this is now again pre-pandemic. The big surprise here was when we looked at the abundance of coronaviruses in FSTP samples, we did not find anything. And this is in contrast to what we found in STPs in India. There might be a few different reasons. The regions sampled were quite different, but again, these are pre-pandemic samples. And so this again, raises some questions in terms of what exactly is it that we see when we look at sewage. Now, sewage is not just human waste. Depending on where in the world we are, sewage is human waste diluted by, in some cases, orders of magnitude with other water streams. And so given the emergence of interest and applications of non-sewage sanitation systems, perhaps NSS systems are an effective way to isolate human output and human bodily output and other outputs. And so these systems must be looked at in terms of pathogen shedding, pathogen distribution, dissemination, and so on, relative to other systems which might have a differential role, a differential impact. Part of the study in India, our study in India, provides a good baseline relative to which post-pandemic and so on, transients could be compared. And again, like I said, the data is there forever. We can go back and interrogate the data for forever. Okay, and then what is the ongoing work? This is part of a vast spectrum of activities underway around the world, looking at surveillance, looking at diversity. Our work is somewhat unique because we focus not just on one virus, we focus across the board, and we do DNA and RNA sequencing and fate work as well. So this allows us to look at mutations. This allows us to look at the source of the viruses or bacteria and archaea, where they're coming from as well. So there's some tracking as well that we can do on that end as well. I'm also part of a Blue Ribbon panel developed, being organized by the Water Environment Federation. And this is to recommend to the CDC, OSHA and EPA procedures and processes and protocols to protect the safety of the wastewater treatment plant and FSTP and sewage treatment plant workers as well. We're also involved in a nationwide effort to inform reopening of communities based on signatures that we see in the water phase, not just wastewater, water phase as a whole. We are also sampling receiving water bodies in some parts of the country as well. One of the most widespread efforts is the standardization of protocols that allows us to benchmark and compare results. That's something that I'm involved in as well. And I'm just saying, I'm just presenting this. These are all ongoing activities. There's a lot of work happening, but I think this is a good point to present what is going on, and perhaps a good point to stop as well. Sorry to go over time. Thank you very much, everyone.
Excellent. Thank you. Thank you very, very much. That was most interesting, and there are already a lot of excited comments. We must have a pretty nerdy audience here, and questions already in the question and answer panel. On to our next guest speaker. We're very happy to have Christoph Ort from UAS, from the Swiss Federal Institute of Aquatic Science and Technology. Christoph, please take it away.
Yes, thank you. If I can share my screen. Good afternoon, everyone. I actually did not speak with Professor Kartik before, but basically my presentation is entirely in line with it. Different data, different things. We didn't agree on what the conclusions are, but I think, as you will see in the end, the conclusions are quite similar. Can you see the acronym here on my web page, or on my page? It's not a typo. We spell it with a W because we look for it in wastewater. And the slides, they should advance soon. Just takes a couple of seconds until Zoom allows me to advance slides. Now it works perfectly. This is a joint initiative by EAWAG and EPFL, funded by the Swiss National Science Foundation, and the surveillance of SARS-CoV-2 in wastewater as an early warning system to track the spatial-temporal development of COVID-19. Quick acknowledgements, you don't have to read it. It's just to say we geared this up basically on February 27. We haven't collaborated before. This is a team that has just gathered in a very short time. And we've actually been successful in collecting almost 500 samples of the wastewater treatment plants spread over Switzerland. You see here a selection of 700 wastewater treatment plants. So there is only 19 on the picture here. And from the green ones, we've collected samples. This covers almost approximately 1 million people. And we anticipate that with, in line with, or let's say with COVID-19, when we select 19 wastewater treatment plants, we could cover more than a quarter of the population in Switzerland with just 19 samples. What does the first data look like? We are by far not the only ones. There are many, many preprints out. There have been many, many data published. What I would just like to show you is in the bottom right here that our data is similar to other data, that it follows somewhat qualitatively the curve of the known cases. But I'll get to this in a minute, why we think this still needs further investigation. I'll just make a quick example here with the biomarker, with the N1 gene, as Professor Kartik mentioned. This is specific targeted quantification. This is not sequencing for everything. We had the first confirmed case on February 25 in Lugano. And if we assume 10 to the 7 RNA copies per gram, 500 grams of feces, with the volume of wastewater that was discharged at this day to the treatment plant, we would expect around 1.4 RNA copies per milliliter. And what we found is about 10-fold. Although we have to say we did not include recovery yet. I'll get into this in a minute. And we have not yet solved the RT-qPCR inhibition entirely yet. So these are semi-quantitative, rather low estimates that we find of the N1 gene in wastewater. This brings me to key questions. You may have seen this. This is the idea of what we could do is, if we have what we all know is from different countries, these line of tested positive cases, and we know or we anticipate that the SARS-CoV-2 RNA in wastewater is in time shed already earlier. Then with some time delay of maybe half a day or a day, we can detect and quantify the SARS-CoV-2 RNA in wastewater. And this brings me to the questions, how much earlier can we do this? How much of value is this as an early warning system? This obviously depends on the sample type. Do we take wastewater or fecal sludge or primary sludge? How much volume do we take? What are concentration methods? How dissolved inhibition methods, extraction and purification issues? How do we analyze, whether we do this with real-time qPCR or whether we do this with digital droplet PCR? Second one is, and all these questions that I now raise is not just by us, that's also acknowledged by others. If we want to make data comparable, as Mr. Kartik also mentioned, to benchmark one location against the other. What are recoveries? How much of what is in the sludge do we actually recover, depending on how we define recovery, whether we report recovery or not. And this is a big call for interlab tests, because we are 2 laboratories and we already do this internally. And this is also one of the reasons why you haven't just published a lot of data yet, but just analyzed a few samples, because we're still in the process of optimizing our method. And then obviously what would be even more advanced is to estimate the number of patients. And you see here, depending on how many asymptomatic and mild development or limited availability of test kits, there is a certain gap. We don't know everyone who's ever had SARS-CoV-2. And also depending on how long this takes until from the onset of the symptom and the time until the test result, also depending on the availability of test kits. And then when we want to quantify, it depends on what is the shedding rate in stool or urine, what actually really ends up in sewage. What is the fraction of patients that do not shed viruses at all, but still they fall sick because of COVID-19? What are the number of reported cases? And one idea would be to benchmark the wastewater findings, the dark brown dotted line here, not with the tested positive, but with random testing. So where you would test not only cases where you'd expect that they may have COVID-19, but also a lot of, like the broader population, where you may have to perform 1,000 tests to find 1 or 2 individuals. So this has been a very rough, short overview, and we are not the only ones, I have to say. Conclusions, yes, we are quite confident that we can use wastewater as an early warning system for SARS-CoV-2 a few days. How much a few is, that depends on many factors, as I've elaborated in my very short presentation. I apologize, this has been very short, but we're sure we can have questions and answers from the audience later. Exact quantification, as Mr. Kartik already pointed out, and as I showed in my presentation, that is probably still a long way to go. Maybe it's not as long as we'd expect because everything is so accelerated these days, and COVID-19 makes many things possible. So we see it also as a chance. And as Mr. Kartik also mentioned before, we should prepare wastewater analysis, not only for a second COVID-19 wave that we all hope that will not happen, but also for other future diseases. And I think with this, I would like to thank you for your attention.
Dr. Ort, thank you so much for that intervention. Really, so many more questions as well have been asked during that presentation. I will now pass over to the moderator, who can, to our facilitator, who will introduce the speakers, the various speakers from utilities. Mr. Nitya Jacob is joining us from New Delhi, and he's the coordinator of Susanna Sanitation Network, Indian chapter. If you could, Nitya, take it away and introduce the different panelists who will be joining. Thanks.
Thank you, Julie. And thank you to the organizers for bringing me on as a moderator. I'd like to thank both the keynote speakers, and they presented extremely interesting results from their lab testing of the SARS-CoV and COVID-2 virus, as well as overall pathogen wastewater. Professor Kartik had made an interesting point that there's a wide variety of DNA and RNA strains in wastewater, both from STPs and STDs in India and the US. And these have very significant impacts on human health, as I think both the speakers, Mr. Ort and Professor Kartik, have pointed out. We've had serious issues with wastewater in India, and we found that nearly 80% of the surface water here is unfit for human use. And the two biggest contributors to the pollution are domestic sewage, which is largely untreated, and industrial effluents. There are regulations in place to monitor water quality, but they're not followed and they're not enforced very well. But ironically, during the lockdown that was due to COVID-19 here, there have been reports that water quality in most rivers has improved quite significantly. Now, in India also, there are many groups working to develop a protocol for testing wastewater for the COVID-19 virus. There is a technical part of the protocol that looks at collection and testing, working with engineers and microbiologists. There's a governance protocol to co-develop this with the city governments and state governments here. And then there's a communication protocol to inform people, use this evidence to inform people about the risks and the precautions that they need to take. We have panelists from the 4 continents, they're water practitioners, and I would like to invite them to share their thoughts. We'll have a couple of rounds of discussion, 2 questions, and then we'll take questions from the audience as well. So I would like initially the panelists to speak about how the utility or utilities in their regions are monitoring water quality, and are they monitoring for COVID-19 as well? And then how is monitoring for COVID-19 and water quality contributing to monitoring overall disease surveillance? Our first speaker, Mr. Sam Azimi, is the Deputy Director of Innovation for the Greater Paris Water Authority, SIAAP. It covers the Greater Paris region with a population of about 9 million, and nearly everybody has sanitation and safe water. While the incidence of COVID is on the decline, wastewater is strictly monitored by sensors. The COVID surveillance has followed the trajectory of the infections. And the Water Authority has initiated a research program to assess how effectively wastewater treatment removes viruses. Mr. Azimi, over to you.
Hello to everybody. Thank you very much to let me speak about our experience of the monitoring of the wastewater treatment plants and more specifically the COVID-19, because before the pandemic, we didn't follow the COVID-19, for you to know. So just to complete, as said Katia, the SIAP is the NITIA, sorry. The SIAP is the Greater Paris Sanitation Authority, who handle 2.5 million cubic meters of wastewater each day, handle it from 450 kilometers of pipes, and treated it on 6 wastewater treatment plants. So a huge area covered around 2,000 square kilometers. During the 14 past years, there was a great substantial industrial transformation in the sanitation system of Paris. Change consisted of improving the treatment quality, passing from the treatment only of carbon to the treatment of the whole panel of carbon, nitrogen, and phosphorus. The change led to a strong reduction of pollution, and we can see that looking at the number of fish species in the Seine River, passing from 3 in 1970s to 32, as I remember, in 2020. So currently, the wastewater treatment plant we have are heavily equipped and monitored, talking about classical parameters, such as COD, BOD, or other classical parameters. Each step of the process facilities are well known by our operators to be in compliance with the Water Framework Directive. Thank you for the picture. To continue this improvement, we develop now smart tools to use this data, the whole panel of data obtained, and to use it as a decision-making tools to help our operators. Here you can see on the picture our work specifically on the COVID-19. That's what to be in compliance with the Water Framework Directive. To go further, we will also use sewage as an observatory of the city and the population evolution. Since 2010, we started a huge monitoring policy to learn about the fate and behavior of other pollutants, such as bacteria, talking about bathing, such as bacteria viruses called ARN phages, or other pathogens. Several studies and research programs supported us to reach our goals to understand these fates and behavior. That's what I can say quickly about the monitoring to be in compliance with the Water Framework Directive and to follow new issues such as COVID-19. You want me to go further concerning the COVID-19, or you stop now for other people to talk?
We could go on with the next speaker, and then we can come back to the COVID-19 in the next.
You should stop me because I'm talkative.
Thank you. Okay, so I think it's what I've heard is that it's important to collect information about COVID in sewage so that we can understand how the surveillance can serve as an early warning system. Thank you. I now turn to Mr. Alejandro Barrio, and please forgive me if I mispronounce the name of the organization. You are from the Dirección Técnica y de Desarrollo Tecnológico, or ISA from Argentina. The utility covers a population of 14.4 million, and 62% of them have sanitation access. ISA monitors wastewater quality in the micro basins, and it has developed a way to test wastewater for COVID as well. Mr. Barrio, could you please tell us how ISA is monitoring wastewater quality as well as COVID in wastewater?
Bueno, buen día para todos, buenas tardes, depende de donde esté cada uno. Bueno, en el caso de ISA, como bien dijiste, cubre una población de 14 millones de habitantes, y hay que tener en cuenta que del total de infectados por COVID-19 en el país, más del 70% a nivel país está dentro del área de acción de ISA. En este sentido, cuando comenzamos allá por principio de marzo a detectar los primeros casos, la empresa tomó la decisión de armar un equipo de trabajo para poder desarrollar una herramienta que nos pudiera ayudar al monitoreo, una herramienta de vigilancia, siguiendo un poco los pasos de lo que se estaba haciendo en Europa. En ese sentido, lo que se hizo fue armar un equipo de trabajo con profesionales e investigadores de la propia empresa. La empresa tiene laboratorios y tiene, bueno, es una empresa, ISA es una empresa grande, y se comenzó a trabajar siguiendo un poco los pasos de lo que había hecho la gente de Holanda y la gente de España. En particular, tomamos contacto con la empresa hermana de Aguas de Murcia, con quienes empezamos a trabajar el desarrollo de la técnica, y hace aproximadamente unas 3 semanas comenzamos ya a tener resultados y a empezar a muestrear todo lo que tiene que ver con la red cloacal. Básicamente lo que hemos hecho es algo similar a lo que se está utilizando hoy en Europa, es la detección de material genético a través de la técnica de PCR, por supuesto con todos los pasos previos que amerita la búsqueda de material genético del virus en un líquido cloacal, es decir, lo que tiene que ver con la concentración de la muestra, luego la extracción del material genético, la verificación de la pureza, con bastante trabajo tuvimos en todo lo que tiene que ver con los inhibidores para agregar, para poder identificar, para poder extraer un material genético sin interferencias, y finalmente a través de la técnica de PCR, hoy a esta altura ya tenemos más de 80 muestras analizadas. Lo que hemos hecho es poner esta herramienta a disposición. Nosotros hicimos el desarrollo de la herramienta, que creemos que es una muy buena herramienta desde el punto de vista de la vigilancia epidemiológica en las distintas etapas de la enfermedad. Hay que tener en cuenta que aquí en la Argentina todavía estamos subiendo la curva, estamos en el proceso de aumento de casos, y bueno, hay distintas situaciones dentro de lo que es el país, porque en el interior la realidad es bastante distinta, pero en lo que es la capital federal y el conurbano, que es más o menos el área de acción nuestra, estamos en este proceso de ascenso de la curva. Con lo cual hemos previsto, la red que opera ISA es una red muy grande, estamos hablando de cerca de 9 millones de personas que tienen servicio de saneamiento, y esta red está dividida en lo que llamamos macrocuencas, son grandes cuencas, hay unas 43 macrocuencas, y cada una de esas macrocuencas está dividida en microcuencas. En total hay un total de 250. Lo que estamos haciendo en esta primera etapa es la verificación a nivel de macrocuencas, y por supuesto que en la medida en que uno tiene infectados en una población, si tiene un método adecuado va a detectar presencia del material genético en las muestras, que es lo que, bueno, lo que hemos verificado nosotros, y la idea un poco es que nosotros hemos puesto a disposición de las autoridades del Ministerio de Salud, que va a ser quien defina las estrategias a seguir en el futuro en cuanto al tipo de monitoreo y en cuanto a los lugares. Es decir, uno puede monitorear una cuenca de 1 millón de habitantes, puede ir a una macrocuenca que tiene 200.000 habitantes, o puede llegar al nivel de un barrio con 1.500 o 2.000 habitantes. Hemos hecho todas estas pruebas. En todos los casos donde hay infectados, claramente se ve, se detecta el material genético a través de la técnica que se está utilizando. En este sentido, para nosotros, lo más importante no es tal vez el valor absoluto de lo que se detecta, sino la evolución en una misma cuenca, en un mismo barrio, la evolución a través del tiempo, básicamente para las fases que vienen en Argentina a futuro, que tiene que ver con la salida, la desencalada, como dicen en Europa, la salida de la cuarentena, y poder tener esta herramienta de monitoreo que nos permita ver si en algún lugar tenemos rebrotes o hay alguna disparada de la curva. Pero bueno, vuelvo a repetir, estamos hablando de una concesión que es una red muy grande, con lo cual no es sencillo poder cubrir hay que tener una estrategia de ver a dónde vamos a hacer foco, en qué lugares vamos a, pero es algo que no lo decide la compañía, no lo decide el operador, sino es algo que va a decidir quienes están gestionando a nivel nacional la política del seguimiento de esta pandemia. Ese es más o menos el punto en el cual estamos, y lo más importante, lo más complejo para nosotros fue la puesta a punto de la caracterización del efluente cloacal. Como ustedes saben, los efluentes cloacales tienen, además de material, de residuos domiciliarios, tienen residuos industriales y otro tipo de compuestos que en una matriz, como es la matriz cloacal, que es una matriz compleja, genera muchas interferencias, y bueno, y ahí hay todo un trabajo a hacer en las fases de extracción del ARN y de los inhibidores que hacen falta para que justamente cuando después se verifica, antes de la PCR, se verifica a través de nanodrops, un equipo que utilizamos para verificar la pureza del ARN obtenido, podamos verificar que no tenemos interferencias y que no está enmascarando estas interferencias el material genético del virus. Esto es más o menos lo que hemos hecho, y estoy abierto a las preguntas que luego quieran hacer.
Thank you, Mr. Barrio. I think you had a multidisciplinary, multi-organization approach to the problem, and it's encouraging to see. I'm sure it will be yielding predictable results. I'll go on now to our next speaker, Mr. Sashidharan Velayutham, who is the Assistant General Manager, Strategic Operations Planning, Inda Water Consortium from Malaysia. This is a national wastewater operator serving a population of 34 million. Mr. Velayutham, we look forward to hearing from you about how the consortium is monitoring wastewater, as well as the COVID situation in Malaysia. We can't hear you, Mr. Velayutham. Or is it just me?
Hello?
Yeah, okay. Now.
Okay. Thank you, Nitya, for your kind introduction, and hello everybody from Kuala Lumpur, Malaysia. And also thank you to the organizers for inviting IWK to participate in this webinar. IWK is a national sewerage company, and we are maybe the only one in the world with one single entity managing sewerage infrastructure throughout the country at the federal level. We have not cited in the world whether there is any other company
I think the video paused and the audio is gone. Hello. I think we're having technical problems. Would it be okay to proceed with the next speaker if it's okay with Julie and the other organizers? And then we can come back to Mr. Wellington.
Fine with me.
Okay, so I think in the interest of time, we'll come back. I'd like to go on to Mr. Fred Nwagaba. And Fred is the country coordinator for GIZ Sanitation for the Millions program in Uganda. This works with the Kampala City Capital City Authority and the National Water and Sewerage Corporation to provide sanitation and water services. Notably, 90% of the people in that area seem to use on-site sanitation services, and the city authority has taken comprehensive measures to monitor and control the COVID pandemic. Mr. Nwagaba, could we please hear your thoughts on wastewater and COVID monitoring in Uganda?
Thank you, Nitya. Good morning, good afternoon, good evening from Kampala. Yes, as Nitya has said, I work for GIZ and Kampala City Authority and National Water and Sewerage Corporation are our partners. And when it comes to the area of waste management, the National Water and Sewerage Corporation takes care of the sewer sanitation, which is just under 10%, to be precise, 8%. And then the 90% is taken care of through the fecal sludge treatment systems. And this is where GIZ has been supporting the partners, especially in the 90%, where you have the off-grid sanitation. So for the monitoring of the off-grid sanitation, we've worked together with the Kampala City Authority and other players to put in place a standard that was before the COVID situation, put in place a national standard. So a national standard still being worked on. And for the traditional sewage treatment that is being monitored by National Water and Sewerage Corporation, where they do the classical effluent, influent, physiochemical, and bacteriological monitoring of the systems. When it comes to the COVID monitoring, the utilities are not yet looking at the direct monitoring of the under the COVID in terms of the wastewater, but they are part of the national task force monitoring COVID using the framework of the Ministry of Health and other partners. And this is where KCCA and National Water then gets the information on the COVID situation. As we speak in the country, we have just over 700 cases of COVID and no deaths yet. So what the utilities are doing related to COVID is to share much more knowledge in terms of the preventive measures, issues to do with ensuring that the service, the utility services does not stop. And then, of course, increasing the protective gear use of their workers, and waiting for from the knowledge of research elsewhere that will come from
Thank you, Mr. Nwagaba. And I noticed that the sanitation situation in Uganda is very similar to India, where nearly half the urban households also use on-site sanitation. I think Mr. Velitum was having problems with his computer. So I think we'll go on to questions. But before that, I would like to hand over to Julie. The organizers are conducting a live poll on the important gaps to scale up COVID-19 wastewater surveillance in developing countries. We'll come back and listen to Mr. Velitum's speech after this. Over to you, Julie.
Thanks. Thank you very much, Nja. Yes, so this is a live poll. So if you would all please go to your browsers and type in menti.com, and we can then enter the code 53350, and you'll all be led to this question. And we'd like you to answer it directly if possible so that we can see your answers roll in before our eyes. The question is the biggest gaps. What are the biggest gaps to scale up COVID-19 wastewater surveillance in developing countries? Everyone is welcome and encouraged to join this poll right now. We have some answers. So what kinds of responses do we have here? What are the possibilities? We have technical guidance on monitoring non-sewered areas, protocols for sampling, collection, transport, and storage, science on how the virus is causing COVID-19 behaves in wastewater or fecal sludge, access to testing facilities, laboratories, which to process samples, prohibitive costs, inadequate collaboration between utilities and health authorities, local government systems and IT software to support decision-making and response. These are our options. The race is on, lots of answers coming in. I'd say we have around 20 there. There are 20 seconds or so left to, let's say 30 seconds left to provide your response. Seems like access to testing facilities is an important one. And we're getting a lot of answers as well for science on how the virus is causing COVID-19 and behaves in wastewater or fecal sludge, which is very much what we're talking about right now. Okay, it's closing in 3 seconds. Any last answers? Okay, we won't discuss these responses right now. We can see them, but we'll save them and we'll put them up on our workplace where you can view them afterwards, and perhaps you'd like to discuss them more in your panel. If we could go to the next question. We have one more question before we go back to the panel discussion. So if everyone could answer this one, who do you look to for technical advice and guidance on wastewater monitoring? Also, the questions are here in French and Spanish. This is a word cloud, so you could just enter in any answer you want. This could be the WHO, you know, your brother-in-law, the local health authority, IWA, UN. Goes. This is, and you can write this in the language of your choice. If you could add a timer there, maybe 30 seconds left to answer this question. The CDC, academic institutions, Delhi, so some national ones. GWOPA, nice. DCDC, doctors, scientific papers. Okay, look, lots of answers. WHO is very much dominating there, followed by some national and local regulators and science authorities. Great. Okay, just 2 seconds to answer, and we've closed up. So we won't look any further at those questions. Thanks very much for participating in the polls, and back to you, Nitya, for the rest of the conversation. Thanks.
Thank you, Julie. That was most exciting. Okay, so I think Mr. Vellutham had some technical issues. He is back, and may I invite you to speak about how the consortium is managing wastewater surveillance and the COVID situation in Malaysia, please?
Thank you, Nitya. Sorry for the interruptions. Anyway, I will continue now. IWK, we operate as a national sewage company. We hold a concession from the government of Malaysia for managing the public sewage systems. We could be the only one in the world with such a scale of number of plants to be maintained by a single entity at the federal level. The sewerage systems in Malaysia could be slightly different from other parts of the world, because from the beginning it has been planned to only receive domestic wastewater, which means industrial wastewater and stormwater drainage systems are not connected to the wastewater treatment plant. I feel this is a blessing in disguise, as we tend not to face much issues with regards to emerging pollutants and industrial toxic or hazardous waste being introduced into the sewerage systems. On overall, we cover about 34 million population equivalent that are connected through about 20,000 kilometers of sewer pipeline to 7,000 over sewage treatment plants. The sewage treatment plants vary in sizes as small as 150 population equivalent to as large as 1.4 million population equivalent. Monitoring of these wastewater plants is a legal requirement in Malaysia. It is mandated under the Malaysian Environmental Quality Sewage Regulations. So operators like IWK need to ensure to take samples from the sewage treatment plant and test it for a list of parameters that are classical parameters for domestic or municipal wastewater. The regulations also stipulate the methods for testing, and we commonly use the APHA method. As a company, we prepare the standard operating procedures for sampling of wastewater and according to the regulations. We have mobile in-house sampling teams that moves around collecting samples from one plant to another on a daily basis. And the schedule is being prepared by our lab. So as far as lab, we have about 5 regional labs, and each lab has a capacity to test about 25,000 samples per year. So annually, we test more than 120,000 wastewater samples from all these plants. Each lab is actually managed by registered chemists and supported by trained lab technicians. All the labs are required to be certified and accredited under the ISO 17025. And this is not a mandatory requirement, it's a voluntary requirement which the company has committed. Now, the results of the test of the wastewater samples, if it is found non-complying, immediate alerts are issued or signal are issued to the plant owners so that they can take immediate actions on the non-compliance. Otherwise, the typical reports will be issued to the plant owners on a weekly basis once all the test data are available, and the data are also uploaded into the Department of Environmental's online system. So at the same time, the authorities also have a transparency in terms of what you call the data of the monitoring carried out by IWK. Now, besides carrying out this regulatory wastewater sampling, we also do operational wastewater sampling. What does operational wastewater sampling means? These are samples taken from the process tanks to actually analyze the condition of the sewage treatment performance, to see whether there's any upset or can see whether there's any enhancement can be done to optimize further the process. So for this, we take samples regularly from the wastewater plants and check for the typical wastewater parameters. Now, besides what you call the optimizations and taking immediate actions on interventions, We also keep this data in our repository so that we have this data to be analyzed where we can devise a program to upgrade the sewage treatment plants or to refurbish the sewage treatment plants to meet future challenges or even the current challenges in terms of overloading of the plants. Now, as far as COVID-19 is concerned, we did not monitor our sewage wastewater for COVID-19 virus. We actually relied a lot on the advisory from our Ministry of Health. We also look up to the World Health Organizations and also the CDC from US on available information about COVID-19 and wastewater. And we are very, very well aware that this is an envelope virus and they could be fragile and it could be present in the wastewater, but we are not sure whether they have any infectivity. But nevertheless, what we have done is we actually monitored all our workers who are working in the sewage treatment plants. We actually deployed about 2,500 workers during the pandemic period to maintain the sewage treatment plants, because this is an essential service. Whatever it is, we have to deliver the service to the public. At the same time, we have to make sure that the workers are safe. So to make sure the workers are safe, what we have done is we have taken preventive measures for them to wear additional PPEs than the normal one they wear in the wastewater. As we know, wastewater harbors a host of pathogens that are dangerous, hazardous. So we normally take precautions on a normal time. But because of COVID-19, we mandated that all the workers must wear face masks and also wash their hands often, use sanitizer and carry them along, as well as maintain social distancing. Yeah? And we monitor the health status of our workers, and we check whether there's anybody has been exposed to the virus. And we are glad and we are proud, and in fact we are grateful to say that none of the 2,500 workers that we deployed during this pandemic was infected with this virus. So that is good news for us, and until today we're still maintaining the record. So therefore, as I said, we do not monitor COVID-19 presence in the wastewater, but we look up to the available information in the public domains, and we practice safe measures. However, the government of Malaysia has commissioned a study on the COVID-19 monitoring in wastewater. Sample has been taken, but to date, because of the lack of facilities to test, because the priorities is given to the health authorities to test for the patients, so the samples are still pending for testing. So that's all for now, and sorry again for the previous interruptions. Thank you.
No problem, and thank you very much. We shall eagerly await the test results, and I think you made an important point of the safety of health of sanitation workers. We're running a little behind time, but we have a few questions from participants. And I would like to maybe open the floor up and pose the question to our panelists, as well as to the two speakers, Professor Karthik and Ort at the beginning. I think one question was about the connection between wastewater management and COVID-19. Where is the connection? I think people are asking. So would someone in the panel like to take that, or Professor Karthik, perhaps maybe you can take a shot at it?
Yeah, sure. Sure.
Yeah, please go ahead.
Bueno, si querés puedo responder yo, Alejandro Barrio. ¿Me escuchas? Sí.
Sure, Alejandro. Could you please answer briefly?
Sí, muy breve. Está totalmente demostrado que los pacientes infectados en sus excretas eliminan el virus, eliminan el material genético. Con lo cual, en cualquier país, en cualquier ciudad, en cualquier barrio donde haya gente infectada, sin ninguna duda vamos a encontrar material genético del virus en el líquido cloacal. Con lo cual, teniendo una técnica adecuada para este monitoreo, claramente es una herramienta que puede servir para hacer el seguimiento a través de los niveles en el líquido cloacal de estas zonas o de estos barrios, de la cantidad de infectados en esa zona.
Okay, thank you. Professor Karthik or anyone else from the panel, would you like to add?
No, that's fine. I mean, I know we are running short of time, so that's fine. I can skip this.
Right. There is another interesting question about how sewer conditions can impact the measurement for COVID or for other viruses and bacteria, given the hydraulic retention time and the chemicals that are used for processing wastewater, as well as other kind of bacteria and chemicals that are present in the wastewater.
Maybe I can take a brief answer to this. This is an interesting question, and obviously I think at this stage we can only draw parallels to other enveloped or non-enveloped viruses and conditions where they are more active or remain active or not. Until now we only know few cases where from stool or in urine or wastewater that SARS-CoV-2 could have been cultivated. And as we have heard from Malaysia, I mean, it's great to hear that at least with taking normal precautions or normal protection against exposure to wastewater or aerosols, it is possible, because there is not only SARS-CoV-2, there is many others, Mr. Karthik said, many other viruses in the wastewater and many other pathogens, etc. And if we take normal precautionary measures to protect people, then this should be not a primary infection route.
And I think we can take one more question, which is an interesting one. How useful is the method of spotting the virus in sewage in poor neighborhoods of least developed countries that have a low percentage of proper sewage systems? So anybody on the panel, or would Dr. Karthik or want to take a shot at it?
Yeah, I can go quickly. I think looking at communities without access to sewer networks or piped networks is especially relevant. For one, because the prospect of dilution of human bodily waste is minimized, dilution with other streams like grey water and so on. So looking at these streams will give us a bit more direct characterization of what these communities are producing. Yeah, so I think that's the benefit of looking at non-sewer communities. And we've also seen this even with systems that separate fecal sludge versus sewage. Sewage is basically going to contain a lot of other things as well, which might complement the picture or confuse the picture. So looking directly at human bodily outputs will be ideal if possible.
I fully agree, but sample collection is more challenging, obviously because of the distributed system of the non-centralized systems. And there have been research groups analyzing primary sludge, where the levels are also higher or seem to be higher, but there is remaining challenges with regard to quantification and inhibition, etc.
Agreed, and I'd just like to also agree on the primary sludge as well. So we need to find better ways to normalize the content, not just volume, but maybe other things in the denominator.
Yes.
Thank you both. I think that's very useful. So we'll continue with our panelists, and I'd like to go back to Mr. Azimi and ask him how they would ensure an open and collaborative partnership with government authorities in wastewater monitoring. And the second part of the question is, how would you inform residents if there were samples of COVID found in tracing wastewater? Mr. Azimi, please.
Thank you very much. First, we have to remember the story. Outbreak of coronavirus started in December 2019, and the World Health Organization declared the pandemic on March 11th. So we had only 3 months to put together all our knowledge to work on this subject. Hopefully everybody worked already on the other viruses and other pathogens to be reactive and to start working on this virus specifically. As said before by Professor Barrio and Mr. Ort, there is a link between the sewer system and the pandemic. Looking at the Paris area, we started sampling at the beginning of the pandemic, beginning of March, and we saw that even when the number of cases were less than 100 people reported, we had already high concentrations of genome per liter in the wastewater. So that's to confirm that wastewater is the good way to follow the pandemic. Maybe not to have a numbered or acute number of cases, but it can help following the pandemic and being an early warning system. To answer the question about the collaborative partnership, on the issue of viral contamination, the SIAP set up a scientific collaboration from 2010, hopefully. In this way, we had already virologists, several scientists in our team to help us to work on methods for the enumeration of the virus. I said, Mr. Ort, as I remember, there is a very difficult way to, on the methods used to estimate the concentration of the virus, specifically the COVID-19 in the sewer, because we measure RNA. Who knows if it's the good RNA? Who knows if there is a infectious capacity in this RNA remaining? So these are the main questions. And in addition to the prospective works started in 2010, for a long time, we focused on RNA phages, virus of bacteria, in the concern of reuse in our case. So we had a real reactivity to respond to this issue of COVID-19 and involving different teams, including the INSERM virologist of laboratory of Mr. Vincent Maréchal, to be able to share knowledge with public, with health authorities, and with government partners. The research objective aims to set up an epidemiologic observatory in wastewater called OBEPINE, it's an acronym, who gives answer about the diffusion of the information and sharing knowledge about this issue.
Okay, thank you. Over to Mr. Barrio, and I think we're kind of running out of time, so may I request the other speakers to be really brief. I've been told we have 10 minutes left. So could you please tell us how you would work in an open and collaborative way with other government authorities, and how would you share information with the public, with the residents, if COVID samples are found in wastewater? Mr. Barrio, please.
Sí. Bueno, a ver, para mí lo primero que hay que decir es, por el momento no se ha informado, a nivel, por lo menos el conocimiento que yo tengo, no se ha informado ningún caso de contagio de la enfermedad a través de aguas residuales. Yo creo que lo importante acá no es pensar si se encuentra. Encontrar se va a encontrar. Como dijo mi colega francés, en todo lugar donde hay infectados, claramente en el sistema de alcantarillado, en el sistema cloacal, vamos a encontrar material genético. Yo creo que lo importante es, en la comunicación a la población, hay que hacer foco sobre comunicar que existe o que hemos desarrollado una herramienta que puede ayudarnos, que es una herramienta más, que no reemplaza al resto de las herramientas que utilizan hoy los distintos gobiernos para luchar contra la pandemia, pero que sí puede colaborar como una herramienta más. Y que es importante que este trabajo se haga en conjunto. En el caso particular de AISA, como AISA tiene su propio laboratorio y tiene su propia, o sea, todo lo que fue la investigación, el desarrollo, el muestreo, la gestión de la muestra y los resultados se hacen internamente en AISA. Pero la empresa puso a disposición del Ministerio de Salud esta información para que sea el Ministerio de Salud quien pueda administrarla. Lo importante, yo creo acá, es dar información precisa a la población, que es una herramienta, que el gran descubrimiento no es que hayamos encontrado material genético en el líquido cloacal. Eso lo sabíamos todos. Cualquiera que estuvo trabajando durante este tiempo en este tema sabe que donde hay infectados, y lo comentó muy bien recién Asimi, incluso con poca cantidad de infectados vamos a encontrar el material genético en el líquido cloacal. Pero esto no tiene que alarmarnos. Y la otra pregunta pegada a esta que también se hizo recién, que tiene que ver con cómo compartir un poco toda la información. Lo que estamos haciendo desde AISA, en realidad desde el COFES, que es el organismo en Argentina que nuclea a todos los operadores. Vamos a estar haciendo probablemente la semana que viene un webinar para compartir la técnica, compartir las experiencias que hemos tenido para los distintos operadores, tanto del país como de Latinoamérica.
Okay, I think that's a great initiative to actually make more information available to the public and to other people. May I request Mr. Veliotam the same two questions, please? How would you work in an open and collaborative way with other government authorities on wastewater monitoring? I know you touched a little bit upon it, but maybe a little more detail there. And if COVID-19 fragments are found in wastewater, how would you communicate that with residents in the area from where it's been found? This is for Mr. Veliotam.
Thank you, Ms. Nitya. I'll answer the second question first. As I mentioned, we do not monitor COVID-19 presence in the wastewater. Therefore, we do not have any information on the presence of COVID in wastewater. Therefore, we don't make any announcement. All announcement about COVID-19 pandemic in Malaysia is made by the health authorities who carries out the screening of COVID-19 among the suspected persons and the patients. They are the only one designated agency in Malaysia is allowed to make any announcement with regards to COVID-19 pandemic and infections. On the second questions on collaborative partnership, I'd like to introduce to you one of the programs that we have with the Department of Environment, which is called a guided self-regulations. Now this is introduced by the Department of Environment because they realize that it is impossible for them to actually enforce the wastewater or any other polluting industry or sectors nationwide with a meager number of resources with the Department of Environment. So they introduced this guided self-regulations where the polluting sectors or the industries need to actually attend some courses with the Department of Environment, and you need to qualify to attend the courses. You should pass some rigorous and rigid assessment scheme with the Department of Environment, and they will award what we call as a competent person. So this is called the Department of Environment's competent person. The competent person is from the industrial sector. He plays a role like a shadow enforcement officer of the Department of Environment in the company. So the role of the person actually will ensure the environmental requirements related to wastewater management in the area is managed and monitored, and ensure that there are corrective actions are taken. And the person must be responsible to ensure all actions and data are properly recorded and documented for the department environments checking. So in this regard, as I mentioned just now, they play the role of the shadow enforcement officer, and IWK is actively collaborating with the Department of Environment so that we work in partnership. We believe in the public-private partnership, and we engage with many government agencies to roll out a lot of plans for the country. Because we are being the national sewerage company, we have a lot of information and ideas and vision for the country. So that is one of the collaborative partnership that we embark on and we continue to embark on. So that's it for now. Yeah.
Thank you so much. That was interesting in terms of the transparency that you have with other government agencies and the collaboration. So over to Mr. Nwagaba, who was our last speaker. And again, the same two questions for you. How would you ensure an open and collaborative partnership with other government authorities? And I know that you're actually working with the KCCA, and so that's sort of kind of like an umbrella authority in Uganda. And then what are the kind of peculiar challenges that you have in Uganda, maybe where it comes to communicating about positive results of COVID tracing in wastewater?
Okay, thank you, Nitya, for that. Yes, in the context of Uganda and Kampala in particular, as you said, KCCA is the umbrella authority, and in there already they have the Kampala Water and Sanitation and Kampala Pollution Task Force that is established. That on which task force you have the Ministry of Health, the utilities, and other actors. So that would be the framework in which the collaboration would be. In terms of the COVID related information, there is also a task force now specifically for COVID led by the Ministry of Health, where regular announcements are given transparently. And in here already the utilities, KCCA and the National Water and Sewerage Utility are part of the team. So the announcement of this would come through those regular national announcements that are being made. The peculiarities in Uganda as far as information sharing about wastewater and COVID is the fact that because of the mobilization against COVID response, one peculiarity that I see is that it has presented an opportunity for openly criticizing or critiquing the system in terms of trying to improve to prevent further infections. So this is a point when then the actors can take advantage and be able to impactfully help in influencing the situation. Thank you. Back to you.
Okay. I had a question, and I think it's kind of left over from the earlier part of the discussion about being able to monitor kind of on-site, a situation where most people are using on-site sanitation systems, like in Uganda. And this also comes partly from the Indian experience that if you're testing a sewer system, it would make sense as an advanced warning method. But if it's on-site primarily, there are challenges in sampling. So how would you see that playing out? And this is especially for you, Mr. Nwagaba.
Yes, you're right, Nitya. The challenge of on-site sanitation monitoring and sampling is pretty big. to the extent that there's quite a very big limitation. And how it plays out in Uganda now is where actually GIZ has been quite active in trying to help in coming out with the national standard peculiar to Uganda when it comes to fecal sludge monitoring, because as you're aware also from the World Health Organization, much of the work is on the other wastewater streams. And then when it comes to fecal sludge management monitoring, you find because of its varied way of characterization from area to area, then you need a national standard. Now, under the national standard that is still under development, so the plan is to be able to do the sampling at the fecal sludge treatment facilities, because as already said, sampling at individual points is quite a cumbersome process that would not yield much result. Thank you.
Thank you. So I think we've run out of time and I'm being asked to wrap up. I would like to thank the speakers and the participants. It's been a great discussion, and I think we have a few big points which seem to emerge from everything that people have said here. So monitoring COVID-19 in poor neighborhoods in these developed countries is definitely useful, both for non-sewer and for on-site sanitation systems. Of course, in on-site systems, there's less dilution, there's less interference from other elements, unlike in sewage, and therefore the sampling, the detection may be more reliable. Of course, like Mr. Nawagaba just pointed out, there would be challenges in collecting samples, but the solution would be maybe to look at FSTPs for the sample collection. It's also interesting to see this global exchange of ideas and expertise between utilities and wastewater monitoring experts and researchers from universities to the utilities and then to other experts as well, to share data and good practices. And I think, we really hope this kind of collaboration is continued and it's deepened in order to really scale up wastewater monitoring. And COVID actually gives us a great opportunity to pull resources together and take this forward. So with that, I'd like to hand back to Julie and thank the organizers once again for this great 4-continent webinar. Thank you.
Nietzsche, thank you so much. Excellent conclusions, and thanks again to all the panelists and speakers for their excellent interventions. We have many questions that have not been answered due to time, but I see some of you have tried to answer them online, but then there will be, a continuation of this conversation on our workplace platform. When signing into this register, webinar, you were asked if you would be interested in joining this thing. If you did not indicate your interest, but are interested now, please note that the links are there in the chat. Information has been provided there. If you still have trouble, then you can write to us at GWOPA, at info@GWOPA. You can find that on our website. So that we can continue to talk about this with the experts that we've had here today, among other COVID-related topics. It's an ongoing exchange between utilities and experts on COVID-related topics. So in addition to that, we have our campaign, Utilities Fight COVID campaign, where we encourage you to share actions that you're taking in this regard. You can find more about that on our website as well. And for future and outcome notes of past webinars that we've held, also please, you can find those on our website. Thank you again very much to everyone. I want to thank in particular Lars Stordal from GWOPA team, who is really the most instrumental in organizing all of this, and to Hannah, Hannah, whose name is Schwarzen. I'm sorry, my German names are so bad. I don't have it right in front of me. Sorry, Hannah. Was so helpful in getting this all organized, and we look forward to joining you next time. At our next webinar. Thank you very much, everyone, and goodbye. And to our translators, thank you. I always forget. Thank you.